Everyone, my name is Shanmas Chua Baldivia and I am a nursing student from NUNESCOS and I am going to perform the skin application. Definition: drug is applied directly to a body site. Assessment: observe for open lesions, rashes, or area of erythema and skin breakdown. 2 is assess the patient for any allergies. Verify patient name, dose, route, and time of administration. Assess the patient's knowledge of medication and procedure. If the medication affects the patient's vital signs, assess them before administration. Objectives is to promote absorption of medication more rapidly through use of certain topical medication, to treat skin disorder and lesion caused by burns or abnormal growth, to dilute effects of a drug, to apply an agent that stops or prevents the growth of microorganisms, to provide a local anesthetic to specified parts of the body. General considerations is nursing measures for applying medication on the skin. Number 1 is be sure the skin is dry and clean before applying anything on it. 2 is clean the skin with soap and water before administering preparations to the skin. 3 is apply local heat to the area when indicated. This measure promotes absorption by improving blood circulation to the area. Shake lotions, which are suspensions of powder, before using the active ingredient reaches the skin in desired amounts. Thoroughly massage cream and ointments into an intact skin, or if this is contraindicated, pat them onto the skin with fingers. B is typical preparation applied to the skin area. Their primary purpose is powder to promote drying of the skin and prevent friction on the skin, ointment to provide prolonged contact of medication on the skin and soften the skin, creams and gels to lubricate and soften the skin and prevent the drying of the skin, astringent and alcohol to cool and dry the skin. Equipment is medication card, medication container, application tube if needed, tongue depressor or tongue blade PRN, and gloves and sterile gauze if needed. Procedure: gather equipment, check medication order against the original physician's order according to agency policy. This comparison helps to identify errors that may occur when orders were transcribed. Step 2 is know the action, special considerations, and safe dose ranges, purpose of administration, and adverse effect of medication to be administered. This knowledge aid the nurse in evaluating therapeutic effect of the medication in relation to patient's disorder. 3 is place medication on a tray, move the medication cart, patient's room, and step 4 is transport medication to patient's bedside carefully and keep medication in sight at all. Careful handling and close observation prevent accidental. Identify the patient by checking the name and identification on the patient's identifications band. Explain procedure to the patient. Cleanse skin surface with soap water unless contraindicated by patient's condition. Dry thoroughly. Remove all old ointment and replace with a new one. 3 is squeeze medication from a tube or using a tongue blade. Take ointment out of a tube or jar. 4 is spread small, smooth, thin quantity of medication evenly over patient's skin surface using your finger or tongue blade to provide an oxalative effect. Protect skin surface with a dressing if needed so that the medication cannot rub off. Assist patient to a comfortable position. This ensures patient comfort. Evaluate patient's response to the procedure and medication. The patient needs to be evaluated for any adverse effects from the medication or procedure. Perform hand hygiene, Hand hygiene deters the spread of microorganisms. Evaluation, skin return to normal state. Desired therapeutic effect is obtained. Experiences no adverse effects including allergy response, systemic effect, or injury.